Hi, my name is Chase, and welcome to the Wellness Center podcast, where we're going to talk all things red light therapy. Thank you so much for tuning into this episode. Please make sure to like and subscribe so you can get updated and notified on all of our newest episodes that we'll be releasing. Have a great rest of your day and enjoy the episode. Hey everyone, this is Chase. Welcome back to the channel. I'm so happy that you're here today. Having a good week so far. I'm recording this on a Saturday and had a couple of great clients come in, had some great conversations with them, was able to help them out quite a bit. It's been really fun. Now, just so you know, like I say every time, if it looks like I'm looking over here, it's because I am. This is where my computer screen is at. This is where the camera is at. So please just give me a little bit of patience. Today, we are going to talk about something a little bit more serious. Well, I mean, all of our stuff is really serious, but we're going to talk about opioid addiction. And I know that affects a lot of people. So yeah, we'll get right into it. So I'm going to share my screen here, and we are going to talk about opioid addiction. So first, I want to, typically how our podcasts have gone in the past is we talk about something, some sort of ailment or disease or mental struggle or something like that. And then we go and talk about, what it is, a little bit of information. Then we go and we talk about what photobiomodulation does for it. And then we talk about some at-home remedies. This podcast, I'm not going to do at-home remedies because opioid addiction, I think, is something really serious and should be handled by a professional of some sort to help you facilitate that, because addiction is very real. Opioid addiction is very real. It's very dangerous. So I do have some effective treatments for opioid. So not at-home remedies, but things you can do in conjunction with red light therapy. And I do want to take a little bit more time to really go through the study instead of just the abstract, because I really want people to know that there is options other than opioid addiction. So an opioid, just looking here on Google, is a substance that acts on opioid receptors to produce morphine-like effects. Medically, they're primarily used for pain relief, including anesthesia. Other medical uses include suppression of diarrhea, replacement therapy for opioid use disorder, reversing opioid overdose, and suppressing cough. So that is what opioids are. Now, I am here on the National Library of Medicine in the National Center of Biotechnology Information, and they're explaining what opioid use disorder is. So if any of these things ring true to you or are affecting you in some way, please seek help. So opioid use disorder has significant impact on the quality of life. It's an epidemic. The persistent use of opioids should be diagnosed and treated properly. Now, opioid use disorder is the chronic use of opioids that cause clinically significant distress or impairment. Oh, man. There are a lot of people who use opioids regularly who have a prescription for them. Patients diagnosed with obsessive compulsive disorder, OCD, arthritis and epilepsy, and many other things. Examples of opioids can include heroin use, morphine use, codeine use, fentanyl, synthetic opioids such as oxycodone. Opioid use disorder consists of an overpowering desire to use opioids, increased opioid tolerance, and withdrawal syndrome when discontinued. It can include dependence and addiction, with addiction representing the most severe form of the disorder. So opioid use disorder is basically reliance on opioids in whatever way that can be. So now we're going to go and look at what photobiomodulation or red light therapy or low-level laser therapy or near infrared light therapy, again, they're all the same thing for the most part, what that can do for opioid addiction. So I am looking on the Journal of Psychiatric Research, and this was published back in January of 2021. The title is Unilateral Transcranial Photobiomodulation for Opioid Addiction in a Clinical Practice, a Clinical Overview and Case Series. So what this guy does in this study is he actually reviews 4 different case reports on what what these people did with opioid addiction. And So quick results. So there was 42 consecutive patients in this practice with opioid use disorder, OUD, where he has given 382 treatments over 18 months. So he's doing a lot of treatments. He's doing it over a long period of time. What these 4 case studies have revealed. So guys, please understand, red light therapy is not a miracle drug or a fountain of youth. It just takes time. I always tell people it's a lot like working out or dieting. If you stop, the results stop. So please understand, this is something you need to continuously do to see results. The authors of subjective clinical observations were that of the 42 patients, 26 of them, which is 62%, consistently had responses to the unilateral transcranial photobiomodulation that were easily observable to the patient, and the author had strikingly beneficial results. 8 people, which is 19%, had helpful but not remarkable responses, and the remainder 19% had no noticeable response. So 81% of clients had noticeable results. That's phenomenal. There were no side effects reported or observed, aside from 2 women who experienced anxiety, which was resolved with psychotherapy. The conclusion is unilateral transcranial photobiomodulation as an adjunctive treatment. Adjunctive meaning you need to do it with something else, whether that's a talk therapist using EMDR therapy or ART therapy, or psychotherapy, something. You need to do it with something else. Treatment to the author's usual in-depth psychotherapy and medication management. So that's what it was. So he used the psychotherapy and medication management as an adjunctive treatment, or the red light therapy was, or photobiomodulation was the adjunctive treatment for those 2 things. He found subjectively that for the majority of patients, this treatment was a valuable self-benefit for their treatment for opioid use disorder. So I want to go and look at this in a lot more detail with you guys today. I try to avoid the big nitty-gritty details of things, but I think with opioid use disorder, it's really important that we look at it in more detail. So I'm going to skip some of this stuff, and I want to go and look at the methods of it. So with the methods, I want to look at the outcomes of these people, so we can understand what kind of opioid use people were using. So we saw a lot of heroin, oxycodone, heroin, oxycodone, heroin, and oxycodone. Okay, so the treatment prior to the light treatments all had been an in-depth psychotherapy that focused on understanding their traumas and ramifications and learning to bear its pains, and had all been on buprenorphine prior to the light treatments. Doses of this stuff were adjusted based on clinical judgments. Most were also on other psychotropic medications such as antidepressants, benzodiazepines, and amphetamines, and their use and dose were felt by the author and the patient to be beneficial. The protocols and parameters for near-infrared treatment was identical to that in our previous study, except that only one hemisphere was treated based on the HEV determined and described below by the lateral visual field test, which it looks like here on 7.2, they closed off this stuff and were only focusing on the exterior part of the eyes. But what they did, they used near-infrared LED cooled with a heat sink and a computer fan. The LED was at 810 nanometers at 250 megawatts per centimeter squares to the forehead for 4 minutes with a fluence of 60 joules per centimeter squared. The author treated the side with a more positive HEV and determined that by the LVFT, in which patients looked at a photograph of an angry man, were asked to score their level of anxiety while looking out of each field. Oh man, this is so heavy, guys, for me. So again, looking at the results here, same stuff. 1 of the 42 relapsed with opioids over the course of their treatment by urine screens, and they were able to work through it with psychotherapy. So guys, I know that opioid use disorder is something that affects millions of Americans every year, and it has a lot of detrimental effects. So guys, if that's something you're going through, please seek help, seek change. Red light therapy here at the Wellness Center, we have protocols to help detox your body, to help with your rehabilitation of drugs. And then here are some effective treatments available, um, effective medications that you can use. Um, there's something called MAT, which is a medication-assisted treatment that you can use. There is, a lot of medications. There are vaccines improving treatment delivery. But yeah, I get this information from the National Institute on Drug Abuse, Advancing Addictive Science, Opioid Use Disorder, and Effective Medications. Guys, please, opioids aren't the only answer. It's not the one right way. There are right ways to help and work through this trauma. So please consider, if you're addicted to opioids in any way, reaching out for help, letting people like my mom and I and other doctors who care and love you guys, let us heal you. Okay, thank you guys so much for tuning in today. For me, that was a much heavier podcast, so I'm gonna go meditate. But please make sure to like and subscribe to the channel so you can get updated on all of our more recent podcasts. I'm trying to release one weekly. Have a great rest of your day. You know there are resources out there.